Snoring is that noise created by the flutter of your soft palate that irritates your bed partner. It's no more a joke, it's actually a social embarrassment. But what is important to know that snoring is very often linked up with obstructive sleep apnea syndrome. That is the condition whereby the upper airway collapses while the patient is asleep, and what happens is the patient chokes like this. The upper airway collapses, the amount of oxygen in the body reduces, but the brain needs the same amount of oxygen all the time. In response to a low oxygen level, the heart has to work harder and pump harder to give the brain the same amount of oxygen. The brain also sends signals to wake up the patient to increase the tone of the upper airway to establish normal breathing again. So the brain is not asleep all the time, it is waking the patient up all night long. The patient wakes up with a sensation of having a poor night's sleep, which is exhibited in a form of excessive daytime sleepiness. The other consequence of obstructive sleep apnea syndrome is that the heart works harder when you're asleep than when you're awake. These condition leads to an increased incidence of hypertension, heart disease, and stroke. So hence, although snoring affects your bed partner, but if it's associated with obstructive sleep apnea syndrome, it affects your health. It will increase the morbidity of heart attack, hypertension, and stroke if left untreated. All patients who have had a heart attack, who has significant hypertension or a stroke, would need to be assessed whether they do snore. And if they do, we need to assess whether there is obstructive sleep apnea syndrome.